back. All across the Central Coast, registered nurses are participating in a national day of action. These nurses are members of the California Nurses Association and the National Nurses United group. Here on the Central Coast, nurses are gathering at Dominican Hospital in Santa Cruz. According to the National Nurses United, tens of thousands of registered nurses are in the process now of bargaining contracts that govern safe patient care conditions and their own workplace safety, they say. KION's Jonathan Sarabia tells us about their calls for more protections, not only for themselves, but also patients as COVID numbers go up again.
Veronica nurses are gathering here outside of Dominican Hospital to demand the prioritization of patient safety and workplace protection. These nurses argue that the COVID-19 pandemic has highlighted problems within their workplace.
So we're out here today with 29 other dignity facilities voicing our concern, frankly, for the failure of the American healthcare system to take care of patients over profit.
One of their demands includes safe staffing levels. Nurse Lauren Dwyer has been working in the medical field for more than 2 decades and currently works in the operating room. She says that even before the pandemic, there has been a shortage in staffing throughout all units as positions are not being filled quickly at Dominican Hospital.
Our employer continually asks us to do the impossible. And nurses are a bit hardwired to take care of our patients first and sacrifice ourselves. And the nurses and the staff are truly at a breaking point because we aren't being kept safe and it's not allowing us to keep our patients safe.
She says this does not only affect patients, but also nurses. Dwyer says many nurses are having to work 14 hours a day, and yet patients are still having to wait longer to get their meals and care from nurses at times.
Sometimes if there's not enough staff, patients don't get the proper education nor their families so that they can understand any of their new medications or any dressing changes they might have.
Cheryl Barty is a chief nurse rep for the hospital CNA union. She says face shields and N95 masks have been issued, but she says they have not been fit tested. She says fit testing is important to know how well they work.
Because we have patients in the emergency room that come in for cut fingers, they could still have COVID. We kind of want to be fit tested for a regular, N95 mask. That's one of our asks that hasn't been happening.
National Nurses United says many nurses have reported being told to use the same N95 mask for an entire shift or for multiple shifts or not being given one at all. They also say more than 400 RNs have died of COVID. Veronica Dominican Hospital told KION in a statement that they are tremendously grateful for the hard work of these nurses in keeping the community safe, but they did not address any of their complaints. Reporting from Santa Cruz, Jonathan Sarabia, KION News, Channel 546.